The human body, this assembly of billions of interconnected cells, represents the pinnacle of biological evolution. Yet, at the very heart of this miraculous system, genetic blueprints can spectacularly derail. Across the world, individuals bear the burden of conditions so rare, so profoundly visual, and so complex that modern medicine struggles to catalog, comprehend, or treat them. Step into the astonishing universe of medical anomalies that continue to shock experts, proving that biological reality often surpasses the darkest fiction. Number 7. Dikoswara, the tree man of Indonesia. Dikoswara, whose name became globally synonymous with the extraordinary, endured an existence defined by epidermodysplasia verruciformis, EV, one of the most troubling dermatological affections ever recorded. His transformation, progressive but relentless, began with small excrescences before metamorphosing into a massive network of ligneous, dense, and brownish structures, covering his limbs like bark and roots. The scientific explanation lies in an extremely rare genetic and virological convergence. Epidermodysplasia verruciformis is a genetic, chronic immune disorder that affects the response of skin keratinocytes. In the majority of humans, the human papillomavirus, HPV, is easily controlled by cellular immunity mechanisms. However, due to a deficiency in specific antigens in Dye's immune system, HPV was able to proliferate unchecked. This immune dysfunction allowed the verrucous lesions not only to develop, but to accumulate in thick, stratified layers, creating the disfiguring and heavy structures that earned him the nickname the Tree Man. The personal cost was incalculable. Physically, Dikoswara was rendered incapable of using his hands and feet for the most elementary functions, plunging him into total dependency and profound social isolation. His case prompted massive media and medical attention, notably the intervention of Dr. Anthony Gaspari in 2008. The surgeries undertaken to remove over 6 kilograms of excrescences offered precious windows of respite, temporarily allowing him to feed himself or touch his children. But the incurability of the underlying immune deficiency guaranteed the aggressive and constant return of the warts. Until his premature death in 2016 at the age of 42, the story of Dikoswara remained a poignant testament to the fragility of the immune response and the resilience faced with an implacable disease. Number 6. Trez Johnson, the child with the duplicated face. Trez Johnson, a Missouri native, is a biological anomaly that defies survival statistics. He was born with diprosopis, or craniofacial duplication, a condition where a part of the face is replicated. His specific presentation involved a partial duplication of the ocular and nasal structures, resulting in a severe and complex deformation of his facial anatomy. The origin of this disorder is found in the complex mysteries of embryogenesis, specifically in the regulation of the sonic hedgehog, SHH gene. The SHH gene is an essential morphogen. It acts as a pivotal signal during embryonic development, orchestrating the formation of facial and cerebral structures and ensuring their correct separation along the midline. An abnormal expression or overactivation of the SHH gene can disrupt this delicate process, leading to a duplication of craniofacial structures. Diprosopis is of astronomical rarity. Cases as severe as Trez's are documented only in a few dozen historical occurrences, and the majority of these newborns do not survive. Trez, however, proved the power of the will to live. His survival is a medical miracle supported by constant care. From the very first days, he faced devastating epileptic seizures, culminating at 400 per day, threatening to destroy his neurological development. Initial prognoses were nil. The Johnson family persevered, managing an open cleft palate and seeking solutions for the seizures. The integration of cannabis oil into his treatment marked a spectacular turning point, stabilizing his nervous system and considerably reducing the frequency of seizures. Reaching adulthood is, in his case, a stunning biological feat, highlighting the profound and still partially misunderstood influence of genetic pathways on the formation of human life. Number 5. Hasna Mohammed Mesmini, the girl who cried crystals. In 1996, the case of Hasna Mohammed Mesmini, a young Lebanese girl, generated a media uproar and unprecedented scientific perplexity. The 12-year-old girl claimed to cry not water tears, but sharp fragments resembling glass or crystals. Testimonies from the time, including those of her family and some local observers, affirmed that these crystal tears appeared and detached from her eyes without causing pain or evident damage to the cornea, at a rate of several occurrences per day. Faced with intense media coverage, the phenomenon was quickly interpreted by some as a miracle or a divine sign, with Hasna herself fueling this narrative with stories of spiritual visits. However, the scientific community was confronted with a major physiological challenge. No known biological mechanism allowed the human body to crystallize sharp exogenous minerals in the conjunctival sac. Although cystinosis and other metabolic disorders can lead to microscopic crystal deposits, they never generate macroscopic geological fragments. Analyses of the fragments found suggested they were terrestrial minerals, not biological deposits. Attempts at thorough examination by skeptics and professionals, although often hindered by cultural factors and media intrusiveness, pointed toward the possibility of extremely clever concealment. Researcher Joe Nickell publicly exposed the ease with which small crystals, like often smooth and small Herkimer diamonds, could be inserted and ejected. Despite surveillance, including cameras, the exact nature of the Mesmini phenomenon was never definitively proven or refuted. The case remains a fascinating example of how faith, perception, and potential dexterity can converge to create a medical mystery that resists scientific rationality. Number 4. Chen Wanji, overcoming congenital Janushavadam. Chen Wanji, a Chinese woman, was born with such an extreme physical deformation that she spent the first 26 years of her life unable to stand. Her diagnosis was severe congenital Janukavatam, or congenital Janu recurvatum, an extremely rare musculoskeletal malformation where the knee joint develops curved backward, creating a pathological hyperextension. This anomaly is the result of incorrect bone and ligament development in utero, often involving displacement or underdevelopment of the tibia or femur, and a lack of stability in the posterior ligament structures. In Chen Wanji's case, the deformation was so pronounced that she had to adopt an entirely quadrupedal way of life. She used the extraordinary strength of her arms to crawl, perform household tasks, and navigate her environment, developing a fierce mental resilience despite immense chronic pain and calluses. The initial prognosis from local doctors was irreparability due to the anatomical complexity and the duration of the deformation. Her salvation came when the Suchi Hospital in Taiwan took on her case. The surgical team engaged in an unprecedented process of orthopedic reconstruction, requiring meticulous planning. Over several months, Chen Wanji underwent precise osteotomies, bone cuts, aimed at progressively breaking and realigning her legs. The surgeons used external fixators to maintain the correction, followed by months of intense and painful physical rehabilitation to strengthen the now stretched muscles and ligaments. Finally, against all odds, Chen Wanji succeeded in standing and walking, making her case a global symbol of surgical ingenuity and the power of human determination in the face of physical adversity once deemed insurmountable. Number 3. Richard Norris, the miracle of complete facial transplantation. Richard Norris's life, a Virginia resident, was shattered in 1997 by a tragic self-inflicted gunshot wound. The result was a catastrophic disfigurement, erasing his entire nose, lips, jaw, and the majority of functional facial structures. For 15 years, Richard lived reclusive, his quality of life reduced to a minimum. Breathing, eating, and speaking had become painful acts, and his appearance had led him to complete social isolation, aggravating a severe struggle with depression. Conventional surgical attempts using skin and tissue grafts from his own body had failed to restore essential functionality. His only hope resided in the medical avant-garde, the complete facial transplantation. In March 2012, he became the recipient of the most extensive and technically demanding facial graft ever performed to date. Under the direction of Dr. Eduardo Rodriguez at the University of Maryland, a team of over 100 professionals conducted a 36-hour marathon operation, replacing his entire face from the scalp down to the neck. The magnitude of the graft was stunning. It included the complex integration of skin, muscles, nerves, bones, upper and lower jaws, and even the donor's tongue. The surgical success allowed Richard to regain the ability to feel, smile, and speak coherently, offering a return to a quasi-normal life. However, this new life comes with a lifelong commitment to immunosuppressive medications. These powerful agents, vital to prevent the rejection of foreign tissues, expose Richard to permanent risks, notably an increased susceptibility to severe infections and a high risk of developing certain cancers and renal insufficiencies. Richard Norris's journey is a constant study of science's capacity to repair the most extreme trauma, while also underscoring the psychological and physiological cost of living at the frontier of identity and medical technology. Number 2, Eli Thompson, the baby born without a nose. Eli Thompson, born in Alabama in 2015, was confronted from birth with congenital arrhythmia, a condition of extraordinary rarity, affecting only about 1 in 197 million births. Arrhythmia is characterized by the complete absence of the external nose, nasal cavity, and olfactory system, resulting from an induction error during the embryonic development of the nasal placodes. Though shocking in appearance, the immediate medical challenge was related to respiratory survival. Newborns are obligate nasal breathers. They breathe naturally only through the nose until they develop oral motor coordination. To ensure his long-term air supply, Eli had to undergo a tracheotomy in his first days of life. This procedure, although life-saving, imposed constant care challenges on his parents. Eli's parents made the admirable decision to celebrate their son as he was, refusing immediate and complex facial reconstruction attempts that could have compromised his quality of life in the short term. Eli's story, widely shared on social media, quickly transformed him into a global symbol of unconditional love and the acceptance of difference. He challenged society's perceptions of what it means to be normal or complete. Tragically, Eli's life was short. He passed away in 2017 at the age of 2. Despite its brevity, his existence left an indelible mark, serving as a powerful reminder of the hidden complexity of biology and the extraordinary strength manifested by families facing the rarest diagnoses. Number 1, the moment of the unforeseen cases. Nora has just arrived in the world, still fragile and peaceful, carried by the warmth of the water and the tenderness of the hands protecting her. Her eyes open slowly, curious and bright, as if she is already seeking to understand this new universe. Every movement is a discovery, every sensation a first time. Around her, everything is calm, reassuring, filled with silent love. Nora does not yet know her story, but it begins here, in this simple and precious moment. An entire life awaits her, made up of dreams, laughter, challenges, and deep bonds, guided by the gentleness of this first instant. These narratives are not mere medical case studies. They are chronicles of extreme human resilience. Despite chaotic genetic mutations, each individual navigated isolation, pain, and existential questioning. They represent the frontier, where failing biology meets tireless medical innovation, reminding us that the quest for understanding and human dignity is the most powerful engine of scientific progress.